Hi, my name is Tasha, and I'm going to be demonstrating the tracheostomy care video today. We would start by entering our patient's room, closing the door behind us for patient privacy. We want to perform our hand hygiene. You want to introduce yourself to the patient. Hi, I'm going to be your nurse today. We want to make sure that we verify their full name and date of birth. Of course, make sure it's on with their wristband as well. We want to start by raising the bed for the patient to a good working height. We want to put our patient in a Fowler or semi-Fowler's position as well. We would pre-oxygenate and suction if we need to. I am going to start off by setting up and grabbing my supplies. They are open for training purposes. All right. So we would pull our gloves out first. And we would pull out our drape here. We're going to want to empty out our contents onto our sterile sheet. At this time, we want to fill each of our sections of the container with normal sterile saline, not each section, but we want to fill the sections that we are doing it. In one of the sections, we're going to want to put a 1-to-1 peroxide solution as well. I am going to put my regular gloves on. In a regular situation, we would want to ask either a nursing assistant or another nurse if they could come in and help us with the procedure, and ask them to just stabilize the trach so that it doesn't fall out or dislodge. We want to remove the inner cannula, unlock it, and put it in our solution so it'll soak there. We'd also want to remove the soiled gauze that's already on it, and we're going to put that in our gloves and remove the soil dressing and discard our gloves. We want to perform our hand hygiene. This time we're going to open up our sterile gloves. Okay. Next, we're going to want to organize our supplies. We will put everything aside and then place all of our swabs into our saline. Next, we're going to want to clean our inner cannula. Take that out of the saline. So we'll want to take the brush and clean it inside and out until there is no more secretions. Okay. Once we do that, we're going to discard the brush, rinse our cannula, and replace it and lock it into place. Next, we're going to want to clean the skin and the flange that's around it. We're going to clean the skin approximately 5 to 10 centimeters around the stoma as well as the flange. We like to use this opportunity to inspect the stoma. I just want to make sure that there's no signs of infection or any skin breakdown around the flange as well. We're going to want to take our sterile gauze and we're going to want to dry the skin around the flange, and then we will replace that dressing. After this, we're going to want to replace our tie. we want to make sure that everything is stabilized if we have an assistant. If not, we can ask the patient to help if they're able to help. Okay, so we're going to keep that stabilized. We're going to grab our tie here. When we decide when we're going to put when we bring the tie around, we do want to make sure that there are no twists because it can cause some skin irritation. So next we're going to tie our knot. If there is any excess, we would, trim that. All right, and then we're going to want to pad our knot here. All right, and if you were to use the tape, you want to make sure you don't put any tape on the patient's skin. You also want to check the tightness and make sure that you can fit your 2 fingers with a snug, but not too tight, okay? If the patient's on oxygen, you're going to want to replace the patient's oxygen. You want to make sure that your patient is in a place of comfort. You want to make sure that the bed is low and locked. Give them their call light so it's near them. We'll want to discard all of our supplies. We're going to want to remove our gloves, perform our hand hygiene, and document our procedure.